Let's talk about the epidemiology of gonorrhea. Gonorrhea is one of the most frequently reported bacterial sexually transmitted infections worldwide. According to global health estimates, millions of cases occur annually, with the higher burden in sub-Saharan Africa, in Southeast Asia, and parts of the Western Pacific. Gonorrhea affects sexually active individuals, particularly adolescents and young adults within the ages of 15 to 29. There's a higher prevalence of gonorrhea in urban areas, specifically in areas with limited sexual health services. Co-infection with other sexually transmitted infections, especially chlamydia trachomatis, is also very common. The increased emergence of antimicrobial resistant strains of the causative agent Neisseria gonorrhea is posing to be a great public health threat to the control of gonorrhea. Underreporting is also very common in developing countries of the world, and this is basically due to stigma, due to reliance, increased reliance on syndromic management. Let's talk about risk factors. Certain risk factors predispose an individual to acquiring gonorrhea, and these factors include having multiple sexual partners, also having unprotected sexual intercourse as well, early onset of sexual activity, inconsistent and improper use of condoms, drug abuse and substance abuse, alcohol abuse, as well as limited sexual health education and awareness. Also, men having sexual intercourse with fellow men. This is particularly important in rectal and pharyngeal infections. These and others are risk factors that culminate to leading to acquisition and transmission of gonorrhea. Let's talk about diagnosis. Accurate diagnosis of gonorrhea leads to effective treatment, prevention of complications, and proper management and handling of the condition. In positive cases of gonorrhea, gram-stained smears show gram-negative intracellular diplococci. They show gram-negative intracellular diplococci, and this is highly sensitive in symptomatic males, less sensitive in females and asymptomatic individuals. Culturing is also another important diagnostic strategy where specimens are cultured on selective media, particularly the Thea-Martin agar, THA, Thea-Martin agar or the modified Thea-Martin agar. This helps in detecting and isolating the causative agent Neisseria gonorrhea under controlled conditions. Also, another diagnostic approach is the use of NAAT. NAAT is the nucleic acid amplification test. This is the most sensitive as well as the most specific method for diagnosing gonorrhea, and it is particularly carried out on specimens such as the urine, cervical, urethral, rectal, and pharyngeal secretions. It is particularly done, this technique is done in modern clinical settings. Antimicrobial susceptibility testing, AST, Antimicrobial susceptibility testing (AST) is carried out to this is particularly carried out due to the increased emergence of antimicrobial resistant strains of Neisseria gonorrhea. The process is carried out to detect and confirm the antibiotic that the particular strain of Neisseria gonorrhea is most susceptible to. This facilitates and enables accurate and proper treatment and management of the gonorrhea condition. Let's talk about treatment. The treatment of gonorrhea is quite challenging due to the emergence of antimicrobial resistant strains of Neisseria gonorrhea. However, ceftriaxone, ceftriaxone, a single intramuscular dose of ceftriaxone is the first line of treatment against gonorrhea. Also, sometimes combination therapy is also used when co-infection, particularly infection with Chlamydia trachomatis is also suspected. Combination therapy is used in those cases. It is also important to note that treatment occurs with sexual partners simultaneously, and patients are strictly advised to abstain from sexual activity before, during treatment, or until treatment is over, and also until symptoms resolve.